Welcome to The Explainer. Today, we're suiting up and diving into what it means to be the hero our dogs need, especially when they're facing a really tough, invisible battle, canine PTSD.
All right, so for this explainer, we are digging deep into the archives of Dogzilla magazine. They published this incredible article that really shines a light on a super important and honestly often misunderstood part of our dogs' lives.
So, our mission today is all about understanding and treating canine post-traumatic stress disorder. We're going to break down what it actually is, see how it impacts our best friends, and, most importantly, figure out how we can help them heal. You know, this single sentence from the article just gets right to the heart of it all, doesn't it? Dogs can carry the invisible scars of trauma just like humans. This is so crucial because we're not talking about a dog being bad or disobedient. We're talking about deep wounds that we just can't see.
Okay, so let's tackle the big question that's probably on your mind right now. Can dogs actually get PTSD? Is this a real thing?
The answer is a huge, resounding yes. Absolutely. The science on this is crystal clear. It's a recognized and diagnosable condition. So the question really isn't if it exists anymore. The real question is, what do we do about it?
Okay, time to put on our science hats. Let's look at the neurological evidence. We're going to go inside a dog's brain to see how trauma can literally rewire it. And that's key. This is a physical change, not just a behavioral choice.
So what does this look like? Well, their brain is basically under siege. You've got two things happening. The amygdala, which is the brain's alarm system, gets stuck in the on position. It's just screaming danger 24/7. At the same time, the prefrontal cortex, the rational thinking part of the brain, shows way less activity. It's basically offline. Think of it like a smoke detector that doesn't just go off for burnt toast, but also sets off the fire sprinklers and deadbolts all the doors. It's a massive, uncontrollable overreaction happening inside their head.
So we know what's going on inside, but what does that internal battle actually look like on the outside? Let's talk about how to recognize the symptoms, the distress signals our dogs might be sending us.
One of the biggest signals is what you could call a code red alert. This is hypervigilance. Their nervous system is just fried from being on guard duty all the time. A dropped set of keys can sound like a bomb going off. They can never, ever truly relax.
You might also see a strategic retreat. We're talking about avoidance, and this isn't your dog being moody or unfriendly. Hiding under the bed, refusing to walk past a certain house, it's a strategy. They're desperately trying to feel safe in a world that, to them, feels incredibly dangerous. They're building their own little fortress of solitude.
So, every story has a villain, right? In this story, the villains are the common triggers, the events that can leave these lasting, invisible scars on our dogs. And these villains can show up in a lot of different ways. It might be a single big event, like a bad car accident. Or it can be the slow burn of chronic neglect, like the horrible conditions in a puppy mill. The most important thing to get here is that trauma is subjective. What matters is the dog's own experience of terror and helplessness. Now, to defeat the villain, you've got to understand its secret weapon. In this case, that's the biology of fear. This is so much more than just being scared. It's a whole survival system that has gone completely haywire. This brings us to a really critical idea, the hijacked amygdala. Remember that alarm system we talked about? Well, it basically takes over the whole operation. The alarm bell just rings and rings, completely bypassing the thinking, rational part of the brain. And that's exactly why you can't reason with a panicked dog. Logic has literally left the building. Survival instincts are in the driver's seat. But here's the good news, and it's really good news. This diagnosis is not a life sentence. No way. Just like in any good hero story, this is where the comeback begins. There is absolutely a path to healing. So every hero needs their toolkit, their arsenal. And for healing, you need a few different tools. First, professional guidance is a must. Get a trusted vet and a veterinary behaviorist on your team. Then you've got behavior modification. That means using smart training techniques to help change their emotional response to triggers. And finally, environmental management. This is huge. It's all about making their world feel predictable and safe again. Now, let's talk about one of those tools that can sometimes feel a bit tricky: medication. This quote just nails it. Medication is not a cop-out. It's really not an easy way out. Think of it more like turning down the volume on all their background anxiety. It just quiets the noise enough so that they can actually learn and benefit from all the behavioral therapy you're doing. Recovery isn't just about making the fear go away. It's about actively building a new story for your dog, a story that's filled with confidence, resilience, and joy. It's about adding more of the good stuff back into their life. So, how do we do that? We give them their power back. Activities like scent work or find it games are fantastic because they let the dog be the expert. It allows them to use their natural talents to succeed. Also, choice-based training, which can be as simple as letting them choose which way you turn on a walk, gives them back a sense of control. We are literally replacing those feelings of helplessness with repeated experiences of success. And this, of course, brings us to the most important character in this entire story, the real superhero on this journey, and that's you. So what are your superpowers in this situation? Well, your number one power is immense patience. You also have to manage your own stress and emotions because your dog feeds off your energy. You need to be their safe harbor, their calm in the storm. Celebrating every tiny little win, building a great team around you, that's your heroic role. And I think this quote just says it all, really. Your patience, showing up calmly day after day, is the most powerful medicine you can provide. More than any training technique, more than anything else, your steady, calm presence communicates total and unconditional safety to your dog's nervous system, and that is the most powerful medicine there is.
You know, the resilience these animals have is just mind-blowing. With the right support from us, many of them don't just heal. They go on to become heroes themselves. I mean, some of these dogs actually become service animals for humans who are also struggling with trauma. It's an incredible full-circle journey.
So, we'll leave you with this question to think about. How can we all create a safer world for our most loyal heroes? Honestly, it starts with understanding. It starts with conversations just like this one. By recognizing that canine PTSD is real, we can all help build a more compassionate, patient, and safer world for our best friends.